There are 4 types of PCOS. Hi, I'm Dr. Nagat. I'm an NHS GP specialising in women's health, and yes, there are 4 types of PCOS. This is a video for those who want to advocate better for themselves and understand what tests you're entitled to and also how your PCOS might differ, because there is no one size fits all and everybody's symptoms are slightly specifically different, and also there's various things that we can do in order to help you manage your PCOS depending on the type that you might have. And for those of you who've been following me long enough, you know that I love to look at my guidelines and my references, the International Evidence-Based Guidelines for Assessment and Management of PCOS, which was done in 2023. This is an international guideline that was put together. It's brilliant. There are some areas that could be slightly better, but actually this is the most informative guide that I found, and I would highly recommend that you look at this if you are looking for how to manage the diagnosis of PCOS. PCOS is a lifelong hormonal all-over body condition and can show up differently depending on the root cause. The first cause can be insulin resistance PCOS, which affects about 70% of women with PCOS. It's linked to how your body uses insulin, a hormone that helps regulate blood sugar. When your body becomes resistant to insulin, it can cause excess insulin production. This affects ovulation and can trigger the ovaries to produce more androgens, or sometimes termed as the male hormone, although it's not just the male hormone, female get it as well. The symptoms of this is that you get cravings for carbs or sugar, fatigue after meals, dark skin patches known as acanthosis nigrans, belly weight gain, irregular periods. For this, you can ask your doctor to check your fasting insulin, your HbA1c, and a glucose tolerance test. The second type is post-pill PCOS, triggered after stopping birth control. Now, some women experience PCOS-like symptoms after stopping the birth control pills, and that's because the birth control pills reduce the body's natural hormone production. And when they're discontinued, there can be a temporary rise in androgen production, and stopping the pill recently can mean that your periods might come out of kilter as well. So if your periods haven't returned, or your acne and hair growth has returned with a vengeance, ask your doctor, could this be post-pill PCOS? Also, just double check at what time or normal cycles might return, and maybe this would be a good time to track, because if you're tracking, we can able to find out the cause and then also hopefully manage your symptoms. This type of PCOS is usually temporary and the body returns to the normal hormone production after a while, but if it doesn't, it's well worth having a chat with an endocrinologist or a gynecologist. The number 3 is adrenal PCOS. Now, this is a less common form of PCOS and usually caused by abnormal stress hormones. Unlike other types of PCOS, which are often linked to insulin resistance or hormonal imbalances, adrenal PCOS is caused by the adrenal glands. These glands produce excess androgens in response to stress. Women with adrenal PCOS might not have the typical symptoms of PCOS like insulin resistance, and they actually might be a low or a healthy weight, but have elevated levels of DHEAS, a specific androgen produced by the adrenal glands. So the symptoms around this could be anxiety, panic, stress sensitivity, fatigue, or just wired energy. And actually these people tend to be slimmer or possibly on the lower weight scale as well. And these individuals get irregular or missed periods. So for a long time, you might be actually getting a missed period for over a year or 6 months or 4 months. In this case, ask your doctor to test you for DHEAS, or cortisol, which is a blood test that can be done in the morning, or an androgen panel. And the 4th type of PCOS is inflammatory PCOS. Now, this is linked to chronic inflammation in the body. Inflammation can stimulate the ovaries to produce excess androgen, disrupting the hormonal balance. So this causes symptoms like bloating, skin issues, so eczema, psoriasis. So always think a little bit more in women, is it just psoriasis or there's something else going on? Joint pains, chronic fatigue, headaches. In this case, ask your doctor to check for your CRP, so your C-reactive protein, vitamin D levels, and you might notice some food sensitivities or gut health support that could also be a factor in the inflammatory processes that you're experiencing. Getting a diagnosis for your PCOS can take time, so be patient, especially if your symptoms don't look like someone else and also you don't look like a typical PCOS patient. So be your own detective. Advocate for your body. Keep asking questions. You are not being the problem by being assertive. You are asking for a second, third, fourth opinion. And also, it's okay to ask for an MDT approach, such as have an endocrinologist, a gynecologist, and someone like me, a women's health GP, because sometimes you have to put the pieces of the jigsaw piece together bit by bit. PCOS is real, even if someone else misses it. And I'm not going to advocate and say, look, I'm always the best doctor and I know exactly, because I need to have my endocrinology colleagues and my gynecology colleagues to help put the pieces together for my patient. So it does take time. It's just sometimes really frustrating, but trust the process, keep advocating for yourself. and I hope this helps, and share with other people who might find this helpful as well. As always, if there's any questions, leave them down below for me.